Hi, and welcome to the second episode, which is on protein. So, I decided to talk about protein because it's really important that everyone gets enough protein, but also there's a lot of misconception about what protein and how much to have. So, what is protein? Because sometimes people do get confused with protein and fibre. Protein is basically a whole bunch of amino acids joined together, and it's only meat, fish, and dairy products and eggs that have the full range of essential amino acids. Um, there's less protein basically in plant foods, but it's still not impossible to get the whole range. And your body can convert some of the amino acids to get the full range that you need. So things change in cancer. Basically, the body needs extra protein as well as extra energy when you're ill, when you're injured, stressed, or to repair any damage that you have going on. Old age, inactivity, and systemic inflammation, which can sometimes happen in neuroendocrine cancer, are known to induce something called anabolic resistance, which is basically a decreased synthesis of protein, or in simple terms, it's a decrease in building muscle mass. We know that muscle protein synthesis and building of muscle isn't completely shut off in cancer patients. There's lots of studies suggesting that the process isn't impaired, and it does remain responsive to additional protein and additional amino acids from the diet. But it's just harder to make the muscles build protein and fibres than in just compared to a normal young healthy individual. There's something called cachexia, which you may have heard of, and this is it's basically double the rate of muscle loss to fat loss, and this happens in advanced cancer, so neuroendocrine cancer and other cancers. And we know that during this period there's something called insulin resistance and something called impaired glucose tolerance, and this is the ability of the muscles to take in glucose, and the muscles don't respond to insulin as well. And we know that during this period especially we have to give more protein, a huge amount, to make those muscles actually work. In terms of neuroendocrine cancer, we don't know yet about any specific protein requirements. We haven't done the tests yet, there is no research going on. We know that in patients with carcinoid syndrome, they have an increased use of tryptophan, which is one of the amino acids. And this may mean that patients with carcinoid syndrome need even more protein than the rest of the group of neuroendocrine cancer patients. We don't know yet, we haven't tested it. So what we do for now is, here in the UK, we follow the ESPEN guidelines, which are the European guidelines written by dietitians. And they say that patients with cancer should have over 1 gram per kilogram and up to hopefully 1.5 grams per kilogram of protein per day. So there are some studies actually saying up to 2 grams per day, but this is not an official guideline yet. In terms of people worrying about that being too much, we know that if you have normal kidney function, the intake of protein in doses up to 2 grams per kilogram are safe. If you do have acute or chronic renal failure, you may have to limit your intake of protein, but you have to see a renal dietitian, so the dietitians that specialise in your kidneys, because they may change your requirements. They may not. They may put your protein first and your your cancer first, basically. It depends whether you're on dialysis and things like that. So if you think you may be struggling to get enough protein, as most people do when they have appetite problems, and plus protein is a very filling thing to eat, what might you want to have? So I think there's a lot of confusion about what protein to eat, and lots of patients go straight away to elimination of red meat, switch to organic, go veggie or vegan, and that's just not necessary. So there are guidelines which promote plant-based protein eating for cancer survivorship and to reduce recurrence of cancer, but for most people living with a neuroendocrine cancer, that doesn't necessarily fit what people need. Most people with neuroendocrine cancer are never given the all clear. Yes, that diet and plant-based protein, really pushing healthy eating, is appropriate for those people in true survivorship. Those with a cure, they need to follow the healthy eating guidelines, and that will apply to some of you. But for those living with a neuroendocrine cancer, we're not so mean. Certainly not in the UK. In Europe, we're not. So just to mention the environment as well, because I think we should be mindful of that animal protein is worse for the environment than growing plant-based protein. And if you are living with a neuroendocrine cancer and you want to go plant-based protein, that's absolutely fine. It's just really hard work to get all of that protein when you do those calculations based on your weight. It's really hard to get all that protein in if you're living on plants, and also if you've got symptoms, the digestive symptoms, and poor appetite, getting all that in every day is actually quite hard. So I just thought I'd mention some kind of portion sizes just so you know roughly what protein is in food. So a couple of eggs is a portion size, about 8 grams each. Chicken and turkey is about, and meat is about 1/3 protein when it's cooked. I thought I'd mention processed foods, so sausages, salami, pepperoni, bacon and things like that. They can be used as an occasional treat if you like them. We don't push people to eat lots of those things. Firstly, because they are strongly linked to bowel cancer and you're still at risk of other cancers, but they can cause carcinoid syndrome in those people that have a sensitivity to things like vasoactive amines. And then on to fish and seafood, really good source of protein as well. 140 grams is roughly the size of the portion, and that's like, if you look at your hand, if you're looking at a piece of fish, it's basically from here to your finger. Things like milk, cheese, dairy foods, absolutely fine, but they contain a little bit less protein, as well as protein in pulses, peas, beans, lentils. There's definitely less in there. We do sometimes use scoops of whey protein powder just to add to smoothies and things like that. We can give you prescribed nutritional supplements. Some are high protein and then some are even higher protein in the small bottles of the shakes and things like that. They're like super protein. And then there's things that you can buy in the supermarkets like high protein yogurt, high protein ice cream now, little cereal bars. You can buy protein shakes in most supermarkets already made up, they don't have to be prescribed. And even brownies and things like that, you can get high protein brownies. So I think it might be useful also to talk about exercise. So if we're supplying the body with more protein, which breaks down into amino acids and then forms more muscle mass, hopefully, We also need to be using our muscles as well to help maintain that muscle mass. There's lots of trials going on with diet plus exercise to try and do this in cancer. And I think it's something that we all try and recommend. There are risks, obviously. You have to take care with heart conditions, carcinoid heart disease, dizziness, immunosuppression, fractures, pain, and people with stomas. But certainly, I know from over here in the UK, Macmillan UK, which is a UK charity, does promote exercise and does say in one of their guides that exercise should be something that patients are doing, because it helps maintain physical function, it helps control fatigue, and it improves bone health. And even in palliative care, kind of low intensity exercise is still recommended. So that's it for this episode. Tune in for episode 3, which will be out next Wednesday. Thank you.